none of these symptoms are related to menopause. So hot flashes are, if you're 12 and the cute boy walks by, you're going to have a hot flash, right? So it's really a vasomotor reaction to, you could say, a stress state. So the reason why women are having these symptoms earlier is because they stop eating fat. They stopped eating fat in the 80s, and animal fat is what all our hormones are made out of. So if you don't eat it, there's no way you can make it. Our liver makes a small amount, but that doesn't cover the needs of cholesterol for brain tissue, myelin sheaths, and stress. The stress response is made out of cholesterol.
Yes. So if a woman's watching this and she's having severe menopausal symptoms, what dietary intervention, dietary strategy would you recommend that woman try immediately?
Eat a lot of animal fat, and that's why my book is called "Good Fat is Good for Women," because it really is. I mean, women do need more fat than men. We make more hormones than men, just like women need more iodine than men, because during adolescence, we grow more sexual characteristics, more tissue expands during a female puberty. So instead, women are the ones who are not eating any fat because they're yo-yo dieting, and they think that the calorie equals the energy that they're going to have to put in their bodies. Unfortunately, it really is the cause of their menopausal symptoms are high cortisol, not enough fat. I usually recommend 80-20. That's what I eat. That's what I've been eating since 52. I do exercise, but I don't eat the protein I think I'm pretty muscular.
You are. I've met Dr. Bright in person. She's very fit.
And I think that, but you also have to address stress levels, because your stress, the cortisol levels will just eat up the hormones that you're trying to, you eat the cholesterol to produce those steroid hormones. So, if you look at the steroid, I'm sure, you've seen it a million times, the steroid hormone cascade, the left side is all the stress response. And if you're constantly using those hormones up to address stress, they won't get to the right side of that cascade, which is your testosterone and your estrogens.
What does a typical day of eating look like for you? And I would suspect that that's the diet you would recommend for any woman who's getting close to the age of menopause.
Well, I would actually recommend it for any woman and also adolescent. I wake up, I have a decaf coffee with my husband now puts an egg yolk and 2 tablespoons of butter. I go paddleboarding for an hour. I do about 6K. And then I come back and I work all day long. I may have a snack, tallow with some like beef jerky with butter, or tallow with a little bit of meat on it. I have about 4 to 6 ounces of steak with some butter for lunch, and the same for dinner.
I love that. And so you go out of your way to add fat every time you eat anything.
I do, because I'm in Italy and we can't get really good ribeye like you can get in the States.
So you're not saying that just only menopausal age women should eat this high-fat carnivore diet. You're saying that we should start our young daughters on a high-fat carnivore diet to help with their hormone optimization, even at very early ages.
Yes, and with the caveat that obviously the woman who is in her 50s is going to have a lot more inflammation than your 12-year-old. So I also see this as an anti-inflammatory approach to address years of dieting, spinning, marathons, things that raise your cortisol level. I wouldn't say that a 12-year-old or a young girl has had experienced that much stress unless she's experienced trauma. So you definitely need, you wouldn't have to be, I'm sure you can have a small amount of carbohydrates depending upon the situation. I have seen young girls who needed to eat a lot more fat and remove the carbohydrates for some health conditions that they had, especially depression.